So the latest InfoTrack poll, the latest InfoTrack COVID-19 poll, basically is a follow-up to the first or baseline poll that we did on the COVID-19 coronavirus pandemic in April. And it generally seeks to ascertain the views of Kenyans on, what they're going through, especially during this period of the coronavirus pandemic. And so we, in this poll, covered more or less the same issues as we covered in April. The first critical area that we would be sharing with you is, the key issues of concern as per Kenyans' views, the top three things that Kenyans feel that government should handle as a matter of priority. We will also be looking at, some of the knowledge gaps that still exist with regards to the coronavirus, and also trying to determine whether, Kenyans are still worried about the coronavirus, they're still concerned and what their concerns are, and whether they feel that the country is ready to open up for free movement and business as usual. And finally, when they think that things will get back to normal, when we'll see a semblance of normalcy, and the performance, their views on the performance of the key stakeholders who are critical in, this fight against the pandemic. So if we look at, the key issues that Kenyans want addressed as a matter of urgency, what we see that there is not much change between April and June in terms of the issues that matter to Kenyans. Indeed, the first issue that matters to Kenyans is still the coronavirus and the COVID-19 pandemic. So 47% of Kenyans want government to still address that issue. In April, we had 55% who were concerned about COVID-19 as an issue that government should handle as a matter of priority. Food security is still very high at 45% and is the second, most burning issue of priority. And the third issue that Kenyans want government to deal with is unemployment, as was mentioned by 35%. Indeed, there is a change in terms of the ranking of unemployment as a priority issue. In April, it was not, among the top three. The third issue was access to healthcare, but it has now come up from 25% in April to 35% now. And that is understandable because we hear every day about the loss of jobs and the loss of incomes and livelihoods of many Kenyans. So those are the top three issues that Kenyans would like government to deal with: COVID, food and poverty, food security and poverty, unemployment, and over and above that, they would like also to see poor infrastructure dealt with. Occasioned by the floods and the heavy rains, Kenyans have been, subjected to very, very poor road networks and very unstable and reliable electricity. And they would like this as the fourth item and issue that government to deal with. Kindly make sure that our roads are safe for use, our bridges are fixed after the flooding, and that electricity is more reliable than it has been in the past 2 months. Access to healthcare still continues to be an issue for Kenyans, and so we see that 18% still feel that access to healthcare is something that government should look into, both with regards to access to healthcare should anyone get the coronavirus, but also with regards to access to healthcare now that health institutions seem to be dealing more with the coronavirus than anything else. Many respondents that we spoke to are skeptical and fearful about visiting health institutions, just in case when they visit those institutions other things happen to them and they may even be quarantined. The next issue of concern, which then becomes the sixth issue of concern, is access to clean water. And we saw that, respondents were telling us that there are cities, including and especially Nairobi, where water has not, run in the taps for more than a month, and people are spending a lot of money accessing water. The flip side and irony is that water is one of those critical elements that is required for the cleanliness that is a preventive measure, that is a prescribed measure to protect against COVID-19. The high cost of living is then, another in the top 10 of issues. And of course, there's a quality of education, especially in the public health sector. And the questions that behoove are, how can our children learn remotely in a manner that is effective enough for them to get proper learning? So the top 10 issues, just to sum it up, that Kenyans want President Uhuru and his government to deal with are: 1, the coronavirus, that's at 47%. 2 is food security and poverty at 45%. 3 is unemployment at 35%. 4 is the poor infrastructure, which is roads and electricity at 19%. 5 is access to healthcare. 6 is access to clean water. 7 is access, high cost of living. 8 is the quality of education. And then 9 is access to affordable and reliable transport facilities. And 10 is disaster management. The dealing with floods and the dealing with, things like the locust invasion. Those two have not escaped Kenyans. But Kenyans also mentioned other issues that they would like the government to deal with. Indeed, they mentioned the high cost of doing business. They mentioned corruption. They mentioned the land squatter issue. But interestingly, Kenyans also are not lost to the fact that this new, crisis, the pandemic, the new normal, has occasioned higher alcohol and substance abuse amongst, across Kenyans of all walks of life. And so we find that 2 out of every 10 Kenyans is quite concerned that government should do something about the alcohol and substance abuse problem that perhaps is now even more prevalent than it was before. They also want the government to deal with ethnicity and tribalism and constitutional reform. So, other than the key issues of concern that Kenyans would like Uhuru and his government to deal with, we also noted some interesting facts that arose from this particular study. In the last study, we saw that about 64% of Kenyans were very keen to stay put because they realized that the pandemic was a danger to everybody, and they needed to keep their social or physical distance and stay wherever they were. But we saw that almost 35% of Kenyans were very, very keen to take themselves and their families up country because it was their belief that in doing so they would keep their families protected from the coronavirus. So we asked the same question in June, and what we do see is indeed slightly more. Nearly 4 out of every 10 Kenyans is still hoping and believing and thinking and intending, if it is possible, to take their families up country because they think it is better to have them up country where they would be better protected from the virus. That generally tells us that if the borders were to be opened today and Nairobi, there was free movement from Nairobi to other places, then 4 out of every 10 of us here would perhaps be intending to, move around and go to up country. And not just ourselves, but with our families in the belief that that would keep them safer. Kenyans are still very concerned about the coronavirus. The level of concern has actually gone up. So we see that when we asked overall, how worried are you about the coronavirus situation in Kenya? Then 67% of Kenyans are extremely worried about the situation, COVID situation in the country, as compared to only 50% in April. And if we combine those who are extremely worried and those who are just worried, which was 14%, then we see that 81% of Kenyans are quite worried about, the coronavirus situation in this country. The level of worry is across the board. Indeed, we see that, 78% of those in Nyanza are very worried. Were very worried in April, but 89% are worried now. So almost 9 in 10 people in Nyanza are very worried about the corona situation right now. Same thing in Western, we have 86% who are very worried. In Eastern, we have 81%, and in Rift Valley, we have 80%. That generally tells us that they are now starting to, these particular regions, because they have started having corona cases, are starting to, come to terms with the fact that the coronavirus is something that can afflict anybody, anywhere, and is not just confined to Nairobi and Mombasa. Indeed, when we asked, the respondents who represent Kenyans, whether, their level of worry was more than before, less than before, similar to before, majority, that 64%, actually said that they were more worried than before. Those who were worried before but are now not worried at all stood at 11%. Those whose worry has not changed is the same as before, is 7%, and the people who are less worried than before are 18%. Now, if we look at this group of people who were very worried before but now are not worried at all, then we see that this 11% generally constitute males, young males between the age of 18 to 25, who predominantly live in the rural areas. What we've seen from the studies that we've done, the tracking studies, is that women, perhaps because they are more than anything else caregivers, are more concerned with the well-being of the family and indeed the health of themselves and their families. And so perhaps it would not be so surprising to see that in certain places where corona is yet to be felt or seen, in certain rural settings, the young who we saw even in April, feeling that this disease does not afflict them as much as it afflicts the older population, which is really what is said out there, are feeling, because they can't see this invisible enemy that we keep talking about. They don't see anybody getting sick. They haven't seen anybody with corona in their environment. They then feel that there's nothing to worry about. And maybe this perhaps was just, one of those things that will blow over or has blown over. Is the worst yet to come? Are we currently experiencing the worst? Is the worst behind us? Or do we just not know what's going on in terms of, what is the situation with the COVID-19 in Kenya currently? Well, what we see is that unlike April, where 40% were very clear that the worst was yet to come, we now see that only 28% think the worst is yet to come. Indeed, most Kenyans, 34% now, believe that we are currently experiencing the worst, as compared to 37% who felt the same in April. And there are very optimistic number of Kenyans, that's, represents 26%, who actually believe that we have gone through the worst is behind us. And we have 13% who really don't know. But generally what it tells us is that people's views on COVID-19 are different based on their circumstances and their perceptions of what this disease means, and what they feel, and what we're seeing right now is that many people believe that we are indeed experiencing the worst with the number of cases that we have of COVID right now. Now, whether that is true or not remains to be, corrected, and is something that would be interesting to hear the Ministry of Health speak to. But generally, I think those who are optimistic that the worst is really behind us may then also be the same people who would want things to normalize very quickly, and that even the things that are the protective behavior don't need to be followed anymore. So that is something that should be paid attention to. Apart from these, there are other concerns that Kenyans generally have on the COVID-19 situation. Majority now, more than before, 89 vis-a-vis 78% before, believe that there are probably many people who have the virus but are not aware that they have it. They are the so-called asymptomatic cases. We also see that more than before, 88% now vis-a-vis 76% before, feel that they will not be able to make ends meet should the virus persist. And then this, of course, begs the question for those who are, proponents of livelihood above life, who basically, then say that it is indeed the case that people are worried because they may not have anything that they will be doing in the next couple of months if we are not able to start reviving and reopening up the economy. What we also see is that the same number of people, 73 in April vis-a-vis 76 now, feel that Kenya does not have, we simply just don't have enough capacity, hospital beds and hospitals to deal with large-scale corona pandemic. And the same number also feels that Kenya does not have the equipment to deal with large scale. So we don't have the equipment, nor do we have the hospital beds to deal with a large-scale pandemic if it happened. And those things are worrying Kenyans. They are worried, in a nutshell, because they are walking around and there are people who may be sick but don't look sick. There are symptomatic cases and who even don't know that they have corona and may then infect people unknowingly. And that is a big concern for 9 out of 10 of Kenyans. So that then points to the fact that testing, mass testing, which probably either right now we're doing voluntary, or that it is actually mandatory mass testing, should happen in earnest, so that it allays the fears of majority of Kenyans who are very worried that there are many people around them who have the virus and maybe just don't know, including themselves. Then the second thing that concerns them is that, of course, and that's by another almost 9 out of 10 Kenyans, is they may not be able to make ends meet. For how long will this be sustainable? How quickly will things get back to normal? Because when we ask Kenyans what they thought about, getting back a semblance of normalcy, majority of Kenyans have no clue. Over 60% do not have an idea as to when the country will get back to normal. And then there is no infrastructure to actually support a large-scale pandemic should it happen. But there are also other concerns that Kenyans have. We asked Kenyans to mention 3 things that are hindering the fight against the COVID-19. And they mentioned many things, but of topmost concern to 71% of Kenyans is the general failure of Kenyans to adhere to government directives. The wearing of masks is done, and the question is it done as a protective measure by most Kenyans, or is it done as a way of, ensuring that the authorities don't arrest you? Because we do see that many people are now adorning the masks under their chin as opposed to covering their whole, the area that is required, only until they meet, a policeman, that they do actually will cover their faces, or when they meet somebody else approaching them, that they do cover their faces appropriately. The issues of physical distancing are questionable, so that whilst Kenyans say they're doing it, many fellow Kenyans have observed that physical distancing has become a bit more lax, and people have relaxed in the way they actually relate to each other. Indeed, we are social beings. But the other thing that Kenyans are very worried about, as mentioned by 42% currently in June, is that there is lack of awareness about the disease. that there needs to be continued, awareness creation, public health education up to the grassroots level. Public health education to that young male, 18 to 25 in the rural area, in a language and manner that he understands, that this disease is ABC and it can do XYZ to you. So those particular, elements of awareness is something that Kenyans are still very worried about. The third thing that worries Kenyans in terms of, things that will make it impossible for us to fight the COVID-19 pandemic is corruption. So that was mentioned by 39% of Kenyans, who generally feel that if the monies that are allocated for COVID-19 were to be used as well and effectively and properly and transparently as they ought to be, then things would be okay. That at this particular point is doubtable to them because they feel that there is corruption that may mar the way that resources are utilized for fighting the pandemic. They also are worried about the weak healthcare system. They're worried about resistance by people to get tested. Indeed, right now the testing is voluntary. And that voluntary testing then means that you do only get a select number of people who probably would not be representative of a whole area. Say if it is, a specific place, whether it's Kawangware or it is Kilimani or it's Kibera or it is any place, Kisumu. If you only allow those who want to be tested, then to get the testing, then ideally it does not provide, a statistically representative, incidence of the COVID situation in that particular place. The other thing that, is worrying Kenyans is the unclear protocols. And this is linked to communication, that Kenyans are still worried, as mentioned by 23%, about what you do if you suspect you have corona or COVID-19. Those steps that you're supposed to take are things that people still feel that many Kenyans don't know, and we still should be sensitized about how we should deal with that particular situation. We've now opened up the economy. At least we have opened it up in the sense that the president yesterday said we can now go into a full day shift of work, an 8 to 5, work day. And that then means that there will be increased demand on our public transport system. Many Kenyans are worried as to whether the public transport system will be able to cope with keeping people safe and respecting and adhering to the physical distancing, prescription that is required for safety. This is something that worries Kenyans. How will the matatus, the buses, be able to cope with everybody going back to work tomorrow without putting at risk the health of several people? Self-medication is another issue that Kenyans are worried about, but they're also worried about the police themselves, the opening up of restaurants, the stigma that is, associated with those who have corona, and then, of course, poverty and hunger and dirty politics. As I'd mentioned, the semblance of normalcy is something that people are now not sure about. 62% just don't know when we're going to get back to normal, which is very different from April, when we were more optimistic and we thought, at least 30% thought that we would get back to normal within 1 to 3 months. And maybe this then speaks to the fact that the communication that is given by the policymakers should actually give us some sense of, when things can get back to normal, or at least give us an indication using information that would help us plan as businesses, plan as parents, plan as individuals for the near future and for the long term, so that we don't suffer the worry and anxiety that most of us are suffering currently. Yesterday, the president's speech was one of the highlights of the week because people were waiting with bated breath to hear what he was going to say. Indeed, our own dipstick dirty surveys said to us, and dipstick just means talking to people randomly and not as scientific as this one we're sharing, said to us that many people had expected the president to, and had hoped that the president would open up the economy completely, open up, free movement, remove the curfew, and generally let just things get back to normal so that the economy could be revived. And the proponents of this point of view are the same who basically say livelihood matters, perhaps more than life. But the question that we see coming up in the findings that we got when we asked people about curfew is that which one is more important? Is it life above livelihood or the vice versa? And it's a chicken and egg situation, especially in the developed world, where the economies that we have cannot support, situations where we have people not going to work at all, or businesses not functioning, optimally for long periods. It would actually lead to economic collapse. But having said that, yesterday the president talked about curfew, and he reduced the hours for the curfew from 5 a.m. to 7 p.m. And now instituted a curfew that is from 4 a.m. to 9 p.m. The restriction of movement still continues, and it is interesting because in our late May, early June study, we asked people about curfew and what they thought about curfew. And I think it would be interesting to note that 57% of Kenyans are today not particularly unhappy with what the president did yesterday. Why is that? Because this 57% of Kenyans wanted the curfew to remain as it was until the COVID-19 situation was deemed manageable. Remember that majority of Kenyans are still very worried about the COVID situation. We also see that 71% of Kenyans are concerned that people have COVID-19, but probably don't know because they're asymptomatic and will very quickly or soon be spreading the virus unknowingly to other people. And then leading to a large-scale pandemic. So the worry is real for most people, life or livelihood irrespective, and 57% today perhaps sitting with a sigh of relief that the curfew was not completely lifted. Indeed, there was 12% in our study of Kenyans who actually wanted the curfew to be relaxed, but continue to be imposed. So 12% are probably extremely elated with what the president did yesterday. However, we have 30% of Kenyans who are not sitting happy today because they wanted the curfew to be done away with completely so that people could move freely at whatever time they wanted and wished, and in whatever way and manner and place they wanted to go to. When we look at, the curfew situation and the support for this curfew to continue, we see that it runs across the board. Indeed, even in Nairobi, 59% wanted the curfew to continue as it was. 64% in Nyanza wanted the curfew to continue. 61% in Western, 61% in Rift Valley, 52% in Central, 50% in Eastern, 51% in Northeastern, and 49% at the coast. So majority, as you can see across the board, wanted the curfew to continue, and perhaps today are sitting with a sigh of relief that it was not lifted completely. And for those who are proponents for livelihood before lives, I think the question that we had most Kenyans tell us when we talk to them in the poll is they cannot imagine a situation where either themselves, their children, their loved ones, their parents get the virus and are not able to recover from it. And they are worried about that. The worry is genuine, the worry is real. Life before livelihood, the two are chicken and egg. Is government doing enough in terms of dealing with the fight or curbing the spread of the coronavirus? Well, majority of Kenyans think that, and that 68% think that government is doing what they can. They're doing their best. And this is not very different from April, where 64% also thought government is doing their best. So generally, Kenyans are basically saying to government, we appreciate what you're doing, continue doing what you're doing, just do more. And that then brings us to the last part of this poll, and the last finding, and that is with regards to the stakeholder performance. Just linked to that, we asked Kenyans to rate the performance of the various stakeholders who are at the forefront of fighting the corona virus pandemic. And quite elatingly is that health workers have scored very high. Our frontline health workers are seen by 77% of Kenyans to be doing an excellent job, as compared to only 58% of Kenyans seeing them to be doing an excellent job in April. So more Kenyans right now really appreciate what the health workers are doing. The Ministry of Health, despite criticisms from certain quarters, have also increased in their performance rating. Whilst their good to excellent performance was, rating was given by 61% of Kenyans, right now 67% of Kenyans feel that Ministry of Health is doing a good job. So the constant updates, the chastising sometimes when we as Kenyans do the wrong thing that we sometimes complain about, should continue. Kenyans appreciate what the ministry is doing. Yes, it gets boring and mundane, but it is those constant reminders that may keep us safe and alive. The media is also perceived to be doing better at 66%. And indeed, the president, who has shown great empathy from the start of this pandemic and understanding of what Kenyans are going through and feeling, is also scoring better. So he's improved in the eyes of Kenyans in terms of his performance. While he was scored at 59% scored him at doing an excellent job, 62% now feel that he's doing an excellent job. The religious leaders are still standing at 42. Their performance has not changed. The Ministry of Interior has also improved from 37 to 42, thinking that they're doing a good job. The private sector, with all the initiatives that have taken place in terms of supporting the vulnerable groups with food and other necessities, essential necessities, has also improved from 31 to 37% in terms of good performance. Government spokesman is at 35% from 34%, and the police's excellent performance has actually gone up slightly, or not slightly, actually it's gone up from 26% to 34%. Although it is important to say that 40% of Kenyans still feel that the police is doing a poor job. Indeed, the institutions or stakeholders that are not being perceived to be doing very well are the county governments, the courts and judiciary, and parliament still is lagging behind, with only 19% of Kenyans thinking that Parliament has done, an exemplary job in dealing with the coronavirus. What we do see is that over almost 50% of Kenyans think that Parliament has done a poor job in dealing with the coronavirus, and that's Parliament meaning National Assembly and the Senate. So they scored the poorest in terms of key stakeholders. Judiciary was also, given by 44% of Kenyans a poor score, and the county administrators got 45% of Kenyans a poor score, and county governments as well are not perceived to be really operating optimally within this COVID pandemic. Thank you very much. So you're going to cut.